Good afternoon. Welcome to the press briefing on the COVID-19. We have Dr. Libby Lee, Undersecretary for Health, Dr. Albert Au, Principal Medical and Health Officer of the Communicable Disease Branch of the Center for Health Protection of the Department of Health, and Dr. Larry Lee, Chief Manager, Integrated Clinical Services of the Hospital Authority. First, the Undersecretary will say a few words. Good afternoon. For the press briefing today, first of all, we will have Dr. Au to give you an update on the epidemic in Hong Kong, and then I will invite Dr. Larry Lee of the Hospital Authority to tell you about the healthcare system. First, Dr. Au.
Friends from the media, good afternoon. I will report to you the situation of the epidemic over the last week. As we can see from the graph, over the last week, the number of cases As we can see from the graph, over the last week, the number is still on the increase. This is the number of daily infections over the last week. There was an increase of 25.5%, and the figure yesterday is a record high in this month. That is to say 14,373. And the main increase is caused by the daily increase of locally acquired cases. Over the last week, the figures was 10,773. That is to say 26.2% up from last week. In terms of imported cases, it shows an increase as well. Over the last week, every day, there were 669 cases in the past 7 days, on average, which was due to the increase of the number of inbound travelers. Taking a look at the percentage of inbound travelers testing positive over the last few weeks, it remains at a stable level. Between the 23rd and the 29th of November, 4.12% of the inbound travelers tested positive among all inbound travelers. The figures hovered at around 4%. Imported cases take up 6.6% of all locally acquired cases. Around 55% were found positive at the airport. In terms of death cases, as with the increase in the number of daily infections, it also shows an increase over the past 7 days. A total of 129 death cases were recorded, 12.2% up from last week. In terms of residential care homes, like community cases, there is a rather remarkable increase. Over the last week, 95 residential care homes reported cases, and some residents were classified as close contacts, 28% up from last week. Among these institutions, 172 residents and 25 staffers were involved. In terms of RCHD last week, a total of 48 RCHDs reported cases, 33 cases up from last week, involving a total of 67 residents and 10 staffers. This graph shows on a weekly basis RCHD and RCHEs reporting cases. As you can see, RCHE reported 95 institutions having cases, compared with a peak in early September. On a weekly basis, there were 42 institutions, that is to say doubling the increase. In terms of RCHD, there is a continuous increase as well. Last week, a total of 48 institutions reported cases, compared with the peak in early September. There were 20 institutions reporting cases, and the increase is more than double. In relation to schools, over the last week, 6,741 cases were involved. When it comes to staff cases, there were 1,325, 17% up from last week. In relation to subvariants, The most predominant variant is XBB. A total of 226 cases of this variant was found, followed by BQ.1.1. Both new mutant variants include BQ.1.1 at 131 cases and XBB at 111 cases in terms of locally acquired cases. This table, as we can see, shows the new subvariants identified in the past 2 weeks. That is to say, we can see the percentages in terms of new subvariants. In the latest week, BQ.1.1 takes up 1.33% of all cases, which is a dip from last week, 1.96%. In terms of XBB, the latest figure is 1.8%. There is also a minor dip from last week at 2.11%. The most predominant strain is still BA.5, taking up 68.75%, followed by other BA.2 lineages accounting for 28.04%. In terms of other surveillance indicators, let us take a look at different districts in terms of the sewage surveillance data. Regarding the viral load per capita, we can see from this graph over the last few days, these figures further increased. And the figure reached between 1.5 million and 2 million RNA copies per liter. Compared with early March, the level is similar to that. It is comparable, and it hovers between 1 million and 1.3 million. There is a further increase, as we can see. Let us take a look at the global situation. This graph is the latest information provided by the WHO, the weekly cases compared with last week. That is to say, between the 28th of November and the 4th of December, the figures remain at a rather stable level. However, we can also see that there are changes, fluctuations in different districts in the Western Pacific region. Over the last few weeks, there is a continuous increase, slowly going up. The predominant strain is still BA.5 globally, accounting for 70.1%. The figure is similar to that in Hong Kong, followed by BA.2 at 10.5%, whereas BA.4 only accounts for 2%. These Omicron subvariants, BA.5, well, that is to say those belonging to BQ.1 account for 36.2%, followed by XBB at 5%. In summary, we can see that over the last week, locally acquired cases continue to increase and are remaining at a high level. There is an increase of 26.2% compared with the daily number of infections last week. RCHD and RCHEs also have numbers at a very high level. Death cases, compared with the previous week, recorded an increase of 12.2%. When it comes to imported cases, they remain at a stable level. Inbound travelers to Hong Kong, 4% of these people tested positive. In relation to other places around the world, there are new subvariants cropping up, becoming more predominant, including BQ.1.1 and XBB, etc. These subvariants have immunity escape. That is to say, they may lead to reinfection. These new variants can be found in Hong Kong. That is to say, they started to crop up in Hong Kong. That concludes my report. Thank you, Dr. Rao. Dr. Lee has the floor. Good afternoon. In terms of the hospital authority situation, over the last week, we have been under tremendous pressure. The number of inpatients, that is to say confirmed patients, remains on the increase. Over 3,200 patients are being hospitalized for treatment. Daily new cases from 300 odd last week to 400 odd people on a daily basis. There is also an increase in the number of inpatients, 90.4% of the patients come from RCHEs. That is to say, there is an increase compared with the last few weeks. These senior citizens have different chronic illnesses. They have low immunity levels. Among the inpatients, critical and serious patients increased to 120 patients or so, according to A&E doctors' reports or data. Over the last week, patients admitted through A&E, around 63% are related to COVID-19, whereas other patients were admitted because of different other medical needs. Over the last week, in the public hospital, those dying of COVID-19, 93% are 60 years old or above. Males take up 57%. 70% of them are more probable to have their cause of death related to COVID-19, whereas the remaining 30%, as we judge, are related to other diseases leading up to their death. We can also see from this table there is an increase in death cases related to COVID-19. From early November, there were 63 cases to over 100 cases in the past 2 weeks, each of the past 2 weeks. For inpatients requiring, respirators, 29, and oxygen therapy, 354. They are below 1% and around 10% respectively. And I have to emphasize, from the actual number of figures, there is an increase alongside the increase of the number of inpatients, that is to say hospitalization cases. Fatal cases are in the increase alongside the increase in the daily number of infections. We cannot lose our guard. In terms of vaccination, I have to appeal to you all. Because of the weather turning cold, with the active level of COVID, you have to remain vigilant. If you haven't been vaccinated, please get vaccinated as soon as possible, especially for the young and the old. For the young and the old, if you have contracted the virus, please seek medical attention as soon as possible. Earlier prescription of medications can help you reduce your symptoms as well as the death rate. As we are approaching winter influenza season, under the double whammy of this virus as well as COVID-19, hospital authority will be under tremendous pressure. We will mobilize resources to provide suitable treatment for patients. I'd like to take this opportunity to express our gratitude to all frontline staff members in the healthcare system because of the increase in the number of COVID-19 patients. And these frontline officers provide services with great devotion to these patients. With Christmas and New Year around the corner, I believe that there will be mounting pressure on the healthcare sector. However, I believe that our colleagues will do their utmost to safeguard the health of citizens.
Thank you, Dr. Larry Lee. So we've heard the reports of briefing of Dr. Albert Au and Dr. Larry Lee. I would like to quickly sum up that in Hong Kong, we see an increasing trend of COVID-19 cases in Hong Kong in terms of confirmed cases, hospital admissions, critical and serious cases, and even death cases. We are seeing an increasing trend. We haven't seen the peak yet, and we don't see any signs of a declining trend. So the hospital authority is now under immense pressure. So we must commend them for their effort. Now, against this background, I would like to report a number of issues. First of all, for anti-epidemic and social distancing measures, and secondly, on the arrangement for the bivalent vaccine. We have balanced all various factors, including the health of the people, their economic development, and the day-to-day needs of the public. The SAR government decides that for the next cycle, that is from the 15th to the 28th of December, we will maintain the existing social distancing measures. However, we will closely monitor the development of the epidemic. Where the circumstances allow, we would like to identify room for further return to normalcy. Here, I would like to invite the public to join hands with the government and hospital authority colleagues to identify room for returning to normalcy. Now, we have to pay attention to our personal hygiene. We have to be fully vaccinated. We have to wash our hands. We have to wear masks. I would like to appeal to the public too. If you are infected with COVID, you have to seek medical treatment as soon as possible. But there are various ways to do so. If you're young and you are fully vaccinated and you do not have any underlying conditions and then your symptoms are mild, you could stay at home and rest. But if you need to seek medical attention, say your condition is serious or is rather serious, then you could choose the telemedicine service, consultation services of the hospital authority, and medication could be delivered to you. If you feel really unwell, or if you have chronic diseases, you are more advanced in age, or you are not fully vaccinated, you could consider going to hospital. But please do try to save our hospital beds for those with genuine needs, both COVID and non-COVID patients. And I would also like to rally on our frontline staff. Now, during the past few years, well, the epidemic may go up or down, and our frontline staff have had a tough time. But I hope together we work together, and then will prevail over that. Now, I would like to announce the latest arrangements for quarantine and isolation. Well, we have always adopted a science-based approach and a precise approach to enhance our anti-epidemic measures. In this table, you see the existing quarantine order and isolation order arrangement. Now, there are those who've had 2 doses of vaccine and others who've not been vaccinated. Now, for isolation order, that applies to those infected. If you've had 2 doses of vaccine, you need to be isolated for 7 days. And then on day 6 and day 7, if your RAT tests negative, then you could complete your isolation early on day 7. But if you have not been vaccinated, or if you had only just 1 dose of vaccine, then you have to wait till the 14th day when your RAT test results negative before you complete your 14 days of isolation. For quarantine order, if you've had 2 doses of vaccine or more, and then on designated days you have done your RAT and your result is negative, then on the 7th day, close contacts could finish the quarantine order early. But if close contacts have not been vaccinated or have had only just 1 dose of vaccine, and then on designated days, even if they test RAT negative, they must still complete the quarantine on day 14. And for arrivals from Taiwan or overseas, they have to do RAT every day until the 7th day after arrival. And then for PCR test, it has to be carried out on the day of arrival and on day 2. Now let's look at some data now. From the 6th of September to the 27th of November, there are some data that we've collected, and we could see that for close contact, in contact with infected persons, the percentage of those who become infected eventually. So how do we read this data? You can see that during this period, for close contacts, there are a total of 350,000 plus, and some 100,000 of them eventually become infected. So the percentage is about 30. And for these 100,000 plus infected persons, when did we identify them? You can see day 5. On day 5, for confirmed or infected close contacts, more than 90% of them are identified by day 5. So that's why we believe it's relatively safe if we shorten the quarantine order to 5 days. And so that's why, starting from midnight on the 9th of December, the SL government is going to change the quarantine order period to 5 days, and there is a need to do RAT every day. For those who've been vaccinated, those who have not been, is there any difference? Again, we study the data. You can look at the column here. That is the number of doses received by close contacts. And we see that by day 5, the situation is more or less similar. By day 5, over 90% of the close contacts would be identified if they become infected cases. So you may see that for those who've had 3 doses, the figure still seems to be so high. It's because there are relatively more people who've had 3 doses of vaccine in Hong Kong. So again, on this basis, we believe that whether someone has been vaccinated or not, the quarantine period for close contacts could be changed to 5 days. So these are new measures. And then for isolation order, now is mostly Omicron infection, and we see from the data for the day 6 and day 7 rapid antigen test RT, and then instead we'll do the test on days 4 and day 5, and then we could complete the quarantine by day 5. It's possible. And as for quarantine order, for those who've been vaccinated or not, they can do RAT every day, and then by day 5 they would have completed the quarantine. For arrivals from Taiwan and overseas, we would like to align the arrangement with the quarantine order. So that means they will have to do RAT until day 5. As for PCR tests, it has to be done on the day of arrival, and the day 2 this does not change. So this new arrangement will take effect from midnight on the 9th of December. The government is going to gazette the arrangement. That means if a person is a close contact and receives a quarantine order, if the person is infected and receives an isolation order, if say the day 1 is the 5th of December, that means this new arrangement will apply to these persons. That means if you are close contact, so you need to do RAT for 5 days in a row and the result is negative, or if you are infected, then on day 6 and 7 the RAT result is negative, then on the 9th of December, you could complete your isolation or quarantine earlier than originally scheduled. And if you arrive from Taiwan or overseas places, then if you arrive on or after the 2nd of December, the new arrangement would also apply to you. That means you need to carry out RAT every day till day 5, and that will be good enough. So that's all I'd like to say. Now, I'd like to turn to the arrangement for bivalent vaccine. The bivalent vaccine is an additional option to COVID-19 vaccines offered by the government. The public may choose to use that as their 3rd, 4th, or 5th dose, but the key message is to get vaccinated as soon as possible. Now, for the Joint Scientific Committee and the Expert Advisory Panel, they have offered their advice to the government last week, and the government's decided to take on board their advice. So I will explain the arrangement. I'll go slowly because it's rather complicated. First, if bivalent vaccine is your 3rd dose, for those aged 18 or above, they could, choose bivalent vaccine as their 3rd dose. And then starting from tomorrow, the 9th of December, people could make appointment to get this 3rd dose. If you've already made an appointment, and if you want to opt instead for the BioNTech bivalent vaccine, you could ask to do so. And if bivalent vaccine is your 4th dose, as I explained before, experts advise for those aged 50 or above, after you've had 3 doses of vaccine, or you've had 2 doses and then you've been infected once, then as early as 3 months later, you could take your 4th dose. These are persons aged 50 or above, so they could take their 4th dose as early as after 3 months. But if you are aged between 18 and 49, you frequent high-risk places, you want to take the 4th dose, you could still make an appointment to do so. But then the vaccine interval is 6 months. As for the 5th dose, for those aged 18 or above, if they've had the 4th dose, or if you've had 3 doses and you've been infected once, then you could take the 5th dose and you could choose the bivalent vaccine, but it will have to be 6 months after your last dose or your last infection. if you are age 18 or above and you are immunocompromised, then you could take the next dose in 3 months. So for these third, fourth, or fifth doses, starting from the 16th of December, 9 a.m., you could start making online appointment, or you could start receiving the vaccine on that day. As for residents in residential care homes for the elderly, experts advise that they take the fifth dose. If residents would like to take the BioNTech bivalent vaccine as their second, third, or fourth or fifth dose, you could tell your home, and then the government will arrange for outreach teams to help you get vaccinated. Of course, if people still want to take the Sinovac or the BioNTech, the original BioNTech vaccines, they could still do so. They could use that as their second, third, or fifth, fourth, or fifth dose. The key message is, again, get vaccinated. Get vaccinated as soon as possible and get yourself protected. That's all I'd like to say for today.
The floor is now open for questions. Please identify your media outlet, as we have a wide coverage today, as well as a good number of reporters. Please ask a maximum of 2 questions. First of all, on the left, and the second last row, the male. Phoenix. From the 1st of November, over 10,000 cases were recorded, with 14,373 cases recorded. Is the administration prepared for such an increase? The Chinese government has announced a new 10 rules as well as other enhancement measures. Is there any signs of Hong Kong opening the border? And no health code examination is required on special premises. Will Hong Kong follow in the footsteps of China? I will defer to Dr. Rao on the effect of the quarantine as well as isolation orders. Right now, we have the current data in relation to our adjustments in the quarantine and isolation orders. As the infected cases have transmission possibilities, that is to say, they have red codes and they couldn't leave their residence of quarantine. We will also issue an isolation order. For those with 2 doses, they will have to be isolated for at least 7 days. If they have a negative results on day 6 and day 7, they can leave. However, with reference to scientific data, if their RET comes negative, the viral load is basically rather low, and the transmissibility is not high. If they have 2 days in a row with RET negative results, these cases are not transmissible, we believe, and they can resume their normal lives. However, we know that some people have received 4 doses of the vaccines, and they have a certain level of immunity against the virus. So in case of infection, they just have a fleeing increase in the viral load, and it may not reach a very high level. Since they can generate a more potent immunity levels, they can clear the virus rather quickly. So on days 4 or 5, they may have RET negative, and we believe that these cases recover quite fast and they do not have transmissibility. And this is, upon our assessment, a rather safe option. On days 4 and 5, if they have negative RET results, these people might not form a great number. On days 6 and 7, some 55% of the infected patients can successfully obtain a negative RET samples on day 6 and day 7, so they can complete the quarantine, the isolation order within 7 days. So they have to have 2 days of negative RET results in a row to qualify as having recovered. As Dr. Lee has explained, for close contacts under quarantine, especially for household contacts, if in the course of quarantine they become positive, on which day they become positive, as Omicron has a short incubation period, generally 3 days. Having regard to data, over 90%, that is to say 93% to be exact. If these close contacts come down with the virus, they will be identified with RET within 7 days. So we can consider shortening the quarantine period to 5 days if they have negative RET results for 5 days in a row. This means that the close contact has not come down with the virus, so they can carry on with their lives. Let me respond to you in relation to the anti-epidemic measures in China as well as the opening of borders. Let us not compare ourselves with other anti-epidemic measures in other places, as the capability of different healthcare systems varies, and different societies also have different level of capability. If we do not take a look at the general picture, holistically consider the whole picture, we will not have a comprehensive and neutral position. Having said that, the anti-epidemic measures in other places can offer some views. They can shed some light so that we can refine or adjust our anti-epidemic measures so that we can march towards normality in a progressive manner. The refinement of the measures in China, the direction is actually the same. We have been working hard to safeguard the health of local citizens, which is in line with the stance taken by Hong Kong. That is to say, we are reviewing our strategies based on science-targeted anti-epidemic measures, proper management of risks, as well as citizen-focused facilitation. We are adjusting our measures having regard to local requirements and the local situation. We have been putting in place different measures to manage the risks, including some high-risk premises, for example, hospitals, schools, RCHEs, some catering premises like Shanghai. There also has to be an anti-epidemic measure put in place to tie in with the policies regarding some reverse quarantine measures. Hong Kong will adopt the most direct approach to boost connectivity to facilitate the reopening of the border. And we will bring you up to speed in due course when we have the latest information. On the right, in the last row in black. The male over there. AM730. It was mentioned just now, those who have not been vaccinated, the criteria are actually the same. Has the government considered other measures so that we can standardize the arrangements for those who have and have not been vaccinated? Is there any preliminary assessment? That is to say, how many people can benefit from this new arrangement? How many can actually finish their orders right away? As we can draw reference from the measures from different places, is the change in the measures because of those refinements in China so that we can take a big step forward? I will defer to Dr. Rao and I will respond to other questions. I hope that you will understand from Dr. Rao and Dr. Lee that the trend of the COVID-19 virus is still on the increase. The figure today is the highest since July. Despite the fact that we should not look at individual figures, we still have to take a look at the overall capability of public hospitals. The hospital authority is actually under immense pressure. We are not concerned about only COVID-19 patients. We are also concerned about non-COVID-19 patients who couldn't receive proper treatment as a result. That is to say, if we have to further relax restrictions, including people who have or have not been vaccinated, there are two factors at play. First, will we further burden the public healthcare system? Second, from the perspective of risk control, we are still of the opinion that the unvaccinated people run high risks. And it goes without saying, we can actually see the figures. That is to say, those vaccinated will prevent the contraction of virus by a very great margin. So we have to tread cautiously to see whether there is further room for relaxation. In relation to whether we have drawn reference from the figures in China, if you have ever studied our figures, we are actually adopting an approach based on science to tie in with the anti-epidemic measures. From the figures, we think that we have room to do so, which is not directly linked to the anti-epidemic measures in China. As I mentioned, these new measures will take effect starting tomorrow. In other words, tomorrow, in accordance with the isolation order, on day 6 or day 7, that is to say on day 5 or day 6, if they have obtained a RAT negative result, they will have completed the order earlier. We do not have a very accurate conjecture right now, but then we estimate less than 30% of cases. As I mentioned, in general, to day 7, only 50% of infections will have 2 days of RAT negative results in a row. And this percentage is expected to further decrease. Those benefiting from these new arrangements, on day 5 of their isolation or quarantine period, they can already benefit from the new arrangements. That is to say, for those quarantine or isolation order holders, they can take a look at their RAT results. If they have 2 days of RAT negative results in a row, starting from day 5, then they will have completed the order earlier.
To the left, the last row, the lady in beige. I'm from Now TV. Now, for the health code on the mainland, it not only applies to elderly homes, schools, and healthcare institutions. In Hong Kong, is there still room for relaxing the leave home safe requirement and the vaccine pass requirement? And then we see that an increase in the number of infected cases. So, is there still room for increase? What is your an estimation? Christmas is just around the corner. If our healthcare system could not cope, then what is your assessment of the latest epidemic situation? Well, let me ask Doctor to answer the question about the workload, the load on the healthcare system for the mainland health code. Well, it's true. There in some high-risk places, there still need to use the health code, such as elderly homes, hospitals, and so on. And then for the health code, it is a tracking application. As for our leave home safe and vaccine pass requirement, we believe with the evolution of the epidemic, there's room for adjustment. But then perhaps given the current increasing trend of cases, perhaps it's not time to consider that yet. Perhaps Dr. Lee could tell you about how the hospital authority is coping with the situation. Well, I would like to share with you a number of messages. First, our observation is when you look at hospital admission figures, and that's the most relevant to the public healthcare system because that is where we have pressure. So, but then it's not directly proportional relationship often. What we want to do most is to protect the young and the old, for patients in particular, because if we are able to protect them, there will be less pressure on the public healthcare system. So that's why vaccination, both COVID vaccines and flu vaccines are important. So the people should get vaccinated as much as possible, especially the young and the old. And also, if you don't feel well, you need to see the doctor as soon as possible, especially for the old. And then for our hospital bed arrangement, we are working very hard to increase the number of hospital beds. We try to avoid adjustment of non-emergency services as far as possible, and this is what we are working hard on a continuous basis. And as we try to increase the number of beds, and at the same time we want to maintain efficiency, and then we also do not want to have to adjust non-emergency services. But if there are more cases, there is a possibility of the need for such adjustment. As for the latest arrangement of the government to shorten the length of the quarantine and isolation orders, that would actually also help to effectively reduce the number of days of hospital stay, and that means we could then handle more patients. So all three factors together, on that basis, we will continue to talk to the government on a science-based approach. We will try to relieve the pressure on the public healthcare system as well as possible. Of course, for our frontline staff, they are always dedicated and working hard to protect the public.
Could you briefly explain the reasons behind the latest easing in the number of days for isolation and quarantine, and also your testing requirements for new arrivals? And my second question is also, I think earlier you also answered it a little bit. Mainland authorities have removed their health code for most venues. So what's the reason behind Hong Kong keeping its leave home safe and vaccine pass checks mandate and also rapid test for bar goers? Thank you.
Okay. The first question is about the explanation about why we actually relaxed the quarantine order as well as the isolation order. When we look back to the data, starting from September to November, basically we find that 30% of the close contacts will turn into positive cases, confirmed cases. The majority of them, more than 90% of them, basically will become positive or confirmed by day 5, and the rest of it, at basically less than 5%, around 5% will be remained detected on day 6 to day 7. According to the basically for all the anti-pandemic measures, we would like to control the risk. We will find that if the isolation order as well as the quarantine order reduced to 5 days, basically the risk incurred is acceptable. So that's why we changed the quarantine order and isolation order into 5 days. Having said that, even we reduce the number of days, there are things that tests that has to be done before the order could be released. For example, for the isolation order, there has to be a day 4 and day 5 negative RAT, rapid antigen test, before the isolation order could be finished or done. For the quarantine order, every day the RAT has to be negative before basically they can be released from the quarantine order after day 5. Same as for those inbound travelers, because the inbound traveler, we treat it as like a quarantine order as well. So we will want to align the practice so the testing will be reduced from daily testing of RAT, reduced from 7 days to 5 days. But we still want to remain the PCR, namely because of the variants, and also from the previous press conference, we have shown you the data about day 2 PCR, we can actually detect most of the cases traveling aboard. So that's why this is the basic reason for the change of the relaxation of the IO or the isolation order or quarantine order. The next question is about the RAT test and the Live Home Safe and Vaccine Pass, the usage of them in some areas or some premises. For all the measures, basically nowadays we adopt a risk assessment and risk control method. For those high-risk area, including high-risk persons or high-risk premises, we would like to have some measures to ensure the control of the risk could be obtained. So for areas like hospitals, like OH homes or residence homes, also like restaurants or the premises that allows eating and drinking, we will consider that is the risk of transmitting the COVID cases is actually still high. So we would like to have some measures to actually protect our citizens when they go into this area, or protect those against going to this high-risk area if they are not well protected by the vaccine. So at the current moment, with the rising trend of the COVID, we will consider it's not quite the right time to relax such requirement at this stage. Maybe when the wave is actually more settled, when we're actually in the later stage, we will reconsider all these measures in one basket.
Okay, let's take one more English question. 尾二個行嗰位。
Hi, a few questions.
有幾條問題南華早報。
The vaccine pass scheme remained in place in Hong Kong, while in mainland health codes are no longer necessary when entering most venues. Would you say Hong Kong's COVID restrictions are stricter than the mainland right now? And since most of the current infection come from the community instead of imported cases, why is the government still requiring travelers to undergo 3 days of medical surveillance? And in what circumstances will the city cut this requirement? Thank you.
Okay. Maybe I repeat it in English. Currently, it is not advisable to compare different areas on using what kind of anti-pandemic measures to control the COVID pandemic, simply because different places have their own conditions, like the healthcare systems, the affordability in the healthcare, in the healthcare system in admitting or treating our patients, and also the vaccination coverage rate are different. So we just simply look at the pandemic measures and compare places against places. It's not comprehensive and it's not an objective tool. So what we should do basically is just look at the local situation to judge whether the COVID pandemic is under control or not under control. And then we should actually adjust our measures according to the situation, the local situation. So it is not advisable to compare places against places on different measures. For the community, you say most of the cases, positive cases, the confirmed cases are from the community. And why shouldn't we actually allow more inbound travelers to come to Hong Kong? Think about it. At the current moment, the hospital system is actually at the edge of, it basically is actually under huge pressure. We don't want to push them at the edge of collapse. So every means that we can control the COVID cases, the number of COVID cases, we should adopt it wisely. If the local cases, there's so many local cases, it is, again, not advisable and it's not advisable to add more new cases outside Hong Kong, down to Hong Kong places, to add more cases and more possible workload to the healthcare system. So that's the reason why we actually think we should still hold the inbound travelers restriction at this moment. In fact, the number of the inbound is actually, the absolute number will increase if there's increased number of inbound travelers, especially later in the holidays.
好，下一個提問。左手邊最後嗰個人黑色衫，sorry
In the last row, the one in apricot. Cable. Over the last few days, daily number of infections range from 9,000 to 10,000. And the Hong Kong U figures are also on the increase. And it is not suitable for further relaxation given the increase of number of infections. We are still on an increasing trend. Is it a good opportunity for us to relax measures? Only half of the patients obtain a positive result. Why do we still need such new arrangements? Or we can let Dr. Lee answer the question first. I will take the first question. The second question, I will defer to Dr. Rao. Do you want to go first, Dr. Rao? Dr. Lee has the floor regarding the reason why there is further relaxation in relation to quarantine orders and isolation orders despite the increase of number of infections. As I mentioned, based on science, targeted proper management of risks, as well as citizen-focused facilitation, that is why we want to have figures behind us to back us up, to see whether it is safe to relax some measures. As we can see from the slides, the PowerPoint slides, within day 5, we are already able to identify most close contacts or patients, with the remaining being identified on day 6 and day 7. So we consider the risks still being low at present. that will not add tremendous pressure to the hospital authority. So we want to have scientific data to back us up to support our relaxation decisions. Regarding the second question, I will defer to Dr. Rao regarding the figures. As Dr. Lee mentioned, regarding the shortening of the quarantine or isolation periods, we are basing on the current scientific data, and this will not cause extra risks to the community. On this basis, we would like to put in place more targeted measures which facilitate citizens having regard to different data for countries or places around the world regarding when can confirmed patients clear all the virus. In general, on day 5, the transmissibility has also tapered off, or the viral load will diminish to a very low level. The prerequisite, however, is that they have to take a test to ensure that their case is not transmissible. If the virus is still transmissible, we will definitely not let the case finish the quarantine period earlier. The isolation order still remains at 14 days, as we believe that some people might take a longer period for them to clear all the virus in order for the virus to be not transmissible. Our measures are that if some people can clear the virus much earlier, we would allow them to complete their orders earlier. For example, if on day 4 or day 5 they already have a negative result and the virus is not transmissible, then there is no need for them to be subject to any order. On the right, the male in last row, Meng Pao, regarding the shortened quarantine and isolation order. The short incubation period of Omicron has been mentioned for half a year, and the home quarantine order has been put in place since February. Why do you relax these measures only now? Because those figures can actually be studied a long time ago. Why were they not studied much earlier? The shortened period of time, is it conducive to the hospital authority? As Dr. Rao said, not a lot of patients turn negative on day 4 or day 5. I will defer to Dr. Lee to take the questions first. Regarding why we relax the measures now, as I said, every decision is dependent on a basket of factors or figures. The first factor is that at present, the immunity barrier in Hong Kong, how high is it? We would like the young and the old to have a higher vaccination uptake, thus giving us more room for relaxation. Adults, in March, compared with March, adults have a much higher vaccination uptake. Between March and November, Hong Kong citizens are actually creating room for us to return to normality. So at this stage, we have sufficient data to support our relaxed decision. You heard from Dr. Rao some figures, some subvariants. Omicron is still the predominant variant, so there is still room. That is why we would like to seize upon every opportunity to return to normality. Regarding the HA situation, I will defer to Dr. Lee. Thank you for your question. Regarding the impact of relaxation on the hospital authority, I understand that there might be mounting pressure on the hospital authority as a result of relaxation. However, it was mentioned that the quarantine arrangements, if shortened, well, they are actually based on science, and on the other hand, they can also enhance our efficiency to mobilize our beds, because the number of inpatients can be reduced. There was a question In relation to the actual number of people benefiting from these arrangements, of course, I will not have a very accurate figures right now. Now, some 3,200 patients are in the hospital, with 2,000 patients being transmissible. They are infectious, and some of them have not received all doses of vaccines. And I believe that they will all benefit from these arrangements because they would have spent a longer period of time in the hospital. And that is why we have this decision. This is the rough picture. On the right in the last row, the female in black. Sing Tao. We have been having record-breaking figures over the last few days. Do you have the ratio of reinfection? The number of imported cases is stable. Is there any room for us to replace RET? That is to say, to replace PCR with RET in relation to the trend of the epidemic starting from mid-November. The epidemic is on the increase. It is on the upward trend. And we will monitor the trend, and it is difficult for us to estimate the peak. And the Hong Kong U figure remains at over 1 for a period of time. That is to say, the effective reproduction rate. In relation to sewage surveillance, it has reached a rather high level, way surpassing the peak in early September. So we expect an increase in the number of cases. There are several reasons behind the increase. First, in society, for infected patients, if not yet fully vaccinated, will have diminishing immunity levels because they have not been vaccinated, thereby increasing the risks of reinfection. And we can see this from the old in RCHE, especially from, well, senior citizens. The latest number of reinfection in RCHE has reached 34.5%. In other words, infected senior citizens in RCHE were probably infected in February or March. However, with the immunity level diminishing and the lack of vaccination, they were infected once again. In the community, reinfection remains at a rather low level, at some 4.9%. We can see that this figure is on a gradual increase. This is within our expectation, though, because of the new variants cropping up. For XBB, BQ.1.1, they take up a rather low proportion of all cases in Hong Kong, and this might not fully explain the reason for the latest increase of caseload. The increase in the number of cases may be due to the increased activities in the community, or people have let down the guard, so there is an increase in the number of transmission links.
代替
For arrivals, can we replace these PCR tests with RATs? Well, Dr. Ao gave us some figures on the percentage of variants. Now, these are cases found in in arrivals through PCR tests. We believe PCR test is an effective way to identify infected cases for those coming to Hong Kong, so they could be taken isolated from the community. That's why we believe this measure remains appropriate at this juncture. Whether there will be a need to adjust the measure when we return to normalcy, well, we will consider it then. But for the time being, we have to keep the PCR test. Next question. To the left, second last row, the one in white. First question about quarantine and isolation measures. Yes, for close contacts and infected cases, the isolation and quarantine period could be shortened to 5, and then on days 4 and 5, the RAT result is negative. How many could actually achieve that? If you relax the measure, but not many would benefit from it, and what is the point? And What about if someone get can it be just a 1 day of RAT negative result? And then for those for the quarantine period, whether someone is vaccinated or not, the quarantine period will be the same. So would it therefore deter or discourage people from getting vaccinated? Which organization do you come from, TVB? Now, okay, first question, Dr. Au. On how many may benefit from the new measures. Now, when the new measure comes into effect, for those who are already under quarantine or isolation orders, if tomorrow, say, is day 5, they could benefit from this new measure. In other words, tomorrow is the day 6 or day 5 of their isolation or quarantine order, and then on days 4 and 5, for 2 days in a row, they have RAT negative results. They don't need to wait till day 7 to complete their orders. Now, how many would benefit? Well, if we look at the number of close contacts or household contacts, then about 26.6% of the close contacts eventually become infected as confirmed cases. The remaining close contacts do not get infected. For those close contacts not infected, they have to wait till day 7 when they have a negative RAT result and prove that they're not infected before they could complete their quarantine. But now they could finish the quarantine earlier on day 5. So we therefore believe about 70% of those under quarantine orders will be able to shorten their quarantine period from 7 days to 5 days. As for infected cases, it will be more difficult to estimate how many may benefit from the new arrangement, because now people don't have to do RATs on days 4 and 5, though therefore we do not know how many people would actually test negative on days 4 and 5. We believe that the proportion is not high. If you look at the number of cases having their red code turn into blue code on day 7, that means 2 days of RAT negative result, the percentage is about 70% and if we take it back further back, then it may be 50% or so. Now, after we shorten the length of the quarantine and isolation orders, does it mean that people may have less incentive to get vaccinated? Well, the isolation and quarantine arrangements have been in place for some time. If people want to get vaccinated, because of that consideration, they would have gotten vaccinated already. Now, for the quarantine or isolation period of 7 days, if it doesn't really help the community much in terms of prevention control, then we should relax the measure. We also have to consider the economy of the place, and we want to go back to normalcy. So where there are measures that we could take to facilitate that, we should do so. And now we are actually reducing the quarantine and isolation duration to 5 days. That's what we're doing now. The one in black, please. Good afternoon. A question for Dr. Lee. Now you see there are indicators of an increasing trend. Still, you are relaxing the quarantine measures. Does it mean that you will always be moving forward and never backwards with your infection control measures? And you say if the circumstances allow, there will be further measures to return to normalcy. But what criteria are there to go by? And then the government keeps appealing to people to get vaccinated, but then only about 630,000 people have had the 4th dose. So do you have a target of the vaccination rate? And if the rate remains low, would you then compel people to have the 4th dose? Now, are we going to backtrack on our path towards normalcy? As we've said many times, we do not want to go backwards. With all measures we're taking, we try to avoid backtracking. Rather, we want to move forward on the track towards normalcy. So, whether there's a possibility of backtracking, it really depends on the healthcare system. That's why Dr. Lee has explained in detail what measures we're taking in the hope that the healthcare system would not collapse, and then we are still able to protect public health. So this is a very important indicator we look at. The vaccination rate for the 4th dose, well, we've only just started administering the 4th dose not long ago, and if we've only just started administering the bivalent vaccine, so we have to wait and see a bit longer. Whether we will make the 4th dose compulsory, well, we're not compelling people to take the first 3 doses. Definitely we're not going to compel people to take the 4th dose. I'm from the Hong Kong Economic Times. Relaxing the quarantine period for arrivals from 7 days to 5 days. What is the reason? And if people are already on their 4th day of quarantine, can they upload their? So that means, does it mean that today they have to upload their day 4 RAT test result, and then tomorrow, if the test result is negative again, then they can complete the quarantine order sooner? Now for Omicron, now many experts are saying that the Omicron is becoming less virulent, is similar to influenza. So do you think that there's still actually more critical or death cases involving Omicron than for flu? Do you still maintain that position? Omicron and influenza, I'll leave that to Dr. Au, and then I'll take the other questions. First, about declaration. As I explained, this measure comes into effect tomorrow. In other words, if you have an effective quarantine or isolation order now, and tomorrow is a day 5 or day 6 or 7, then you could benefit from this arrangement. For those who are on day 4 tomorrow, they could do an RAT test. If it's or today is the day 4, they could do an RAT. If it's negative, tomorrow they do RAT again. And if it's negative, that means they are not infected, then they could complete their quarantine tomorrow. But then we must appeal to the public. As Dr. Lee said, for about 93% of the cases, they are detected within the first 5 days. So there's still a small chance that for close contact, the person is negative on day 5, but eventually the person may test positive. So you still need to monitor your own health condition, and we would suggest that you continue to do RAT for a few more days, and if you test positive, you must declare to us. And for confirmed cases, if they do get a second negative result tomorrow and on day 5, then they could declare that they have 2 consecutive days of negative result, and they need to declare it online, and then the record will be turned into a blue code, and they would have completed the isolation order. Second question is about influenza. Now, many people often compare the 2 respiratory infection diseases, but they are actually 2 different kinds of virus. In terms of public health, we are equally concerned about the 2 viruses. Now, influenza has been around for a long time. It's an endemic disease. Every year, we will see seasonal flu cases. Well, maybe you've been infected before. As for COVID, it's a new infectious disease and is highly transmissible. And in terms of the herd immunity is still not there, so we have to rely on vaccine to protect people. As for the fatality rate, it's relatively high for the old and the young. We could look at the figures for those aged 60 or above. The fatality rate for COVID is as high as 7.48% for those not vaccinated. For those not vaccinated and aged 80 or above, the fatality rate is 14.69%. So therefore, we would like the public to complete their vaccination and give themselves protection. We see that in Hong Kong, the vaccination rate for the old and the young is still below par. As for influenza, we are concerned about it now. In summer and in winter, we usually will see the seasonal flu season. And every time when it's the seasonal flu season, we'll see death cases from flu. So influenza is actually not a mild disease, especially for those with chronic illnesses. So therefore, we encourage people to receive the flu vaccine. Especially this year, In many other places around the world, we see serious outbreak of influenza cases. They have come earlier, and the number of cases is high. So in Hong Kong, it's possible that we will also see an outbreak of flu cases. That's why we appeal to the public to get vaccinated for flu. This will lessen the burden on the hospital authority system, and that will help. Thank you.
抵港嘅
In relation to arrivals from overseas or Taiwan, regarding the quarantine orders or isolation orders, we would like to have consistency in the policies. That is why we align the RET requirements to 5 days. Any more questions? No questions. That's the end of the press briefing today. Thank you.